Stroke is any alteration to the blood flow to the brain. There are two types of stroke. In ischemic strokes, there's a blood clot that stops blood flow to a part of the brain, and the cells therefore die because they're not getting oxygen or blood. In a hemorrhagic stroke, there is a burst in a blood vessel, so the blood comes out into the brain itself. That's an intracranial hemorrhage. It's important for everyone to recognize the signs and symptoms of stroke. These include the sudden onset of difficulty talking or understanding what people are telling you, sudden onset of numbness and weakness, particularly if it involves one half of your body, sudden onset of trouble seeing, sudden onset of difficulty walking, or a sudden unexplained headache that's atypical for you. If you notice those symptoms either in you or in someone around you, it's important that you call 911 immediately. There are treatments for stroke, but for them to be effective and safe, they have to be started within 4.5 hours of onset of symptoms. Stroke is treatable. The important thing is that you get to the hospital as soon as possible after the symptoms start. Once you get to the hospital, you'll have a full evaluation to figure out what type of stroke you have and if you're a candidate to receive treatment with the medications that break up the clots that are stopping blood flow to the brain. This typically have to be started within 4.5 hours of the onset of the symptoms. So prompt arrival to the hospital is very important. If you arrive a little bit later, you may be offered treatment with other interventional procedures such as catheters threaded up the arteries to the clot itself to try to pull it out. And regardless of which treatment you get, it's important that you're under carefully monitored conditions to make sure your blood pressure is in the right parameter, your blood glucose, and that we can prevent and identify any possible complication that arises. Suburban Hospital is certified as a primary stroke center by the Joint Commission and the Maryland Institute of Emergency Medical Services System. This certifies that we have all the protocols in place to rapidly identify, evaluate, and treat patients with potential stroke, and it also signals to the emergency medical services to bring patients with potential stroke directly to Suburban Hospital. One of the strengths of the stroke program at Suburban Hospital is that we have access to MRI as the first imaging study in patients with stroke. This allows us to determine with certainty whether you're having a stroke or not, what type of stroke you're having, and also if there are other pathologies in your brain that will affect our treatment decisions. At Suburban Hospital, we have a stroke team that's available 24 hours a day. In this stroke team, a group of nurses who are specialized in stroke care, as well as vascular neurology attendings and vascular neurology fellows, will be working together to identify the type of stroke you have and prescribe the optimal treatment. Because of our collaboration with the NIH, we're able to offer patients treatments that go beyond the standard TPA time window, which is 4.5 hours. For example, patients who wake up with a stroke are usually excluded from treatment with TPA, and we have a clinical trial that's evaluating whether we can use MRI to identify those patients in whom this medication can be used safely. So the focus of the NIH research at Suburban Hospital is the use of MRI as a technology to help us identify patients who may benefit from standard and new therapies for stroke. We're also using MRI to help us understand the processes that go on in the brain as someone is having a stroke, and hopefully this will lead to the development of even newer and better treatments. A stroke can happen to anybody. Young people can have them, adults can have them, and elderly people can have them. They're more frequent as people get older, especially after the age of 65. And those who are most prone to have them are those with risk factors such as hypertension, diabetes, high cholesterol, people who live a sedentary lifestyle, and those who smoke. The good news is that stroke is preventable. You can prevent a stroke by controlling the risk factors. So find out if you have high blood pressure and treat it. Also treat your diabetes and follow your doctor's directions regarding high cholesterol. It's important also to lead an active lifestyle, exercising for 20 minutes each day, and to eat a healthy diet. low in fat, high in fruits, vegetables, and grains.